Welcome to The Explainer. Today, we're going to tackle a big one, a condition that affects millions of people, often without them even knowing it, type 2 diabetes. We're going to cut through all the medical jargon and give you a really clear, practical guide to what it is and what you can do about it.
Okay, let's kick things off with something that might really surprise you. Millions, and I mean millions, of people are walking around with type 2 diabetes and have absolutely no idea. And why is that? Well, it's because the first signs are so easy to miss. Things we all just brush off as being tired or a little stressed out. And that's exactly why getting a handle on this is so important. So, what's really going on here? At its heart, what even is type 2 diabetes? Well, to get it, we've got to look at how our bodies use fuel. Just imagine your body is like this amazing high-performance car, but for some reason, the engine is sputtering and can't get the energy it needs, even though the gas tank is totally full. Let's dive into that. At the very center of this is a concept called insulin resistance. And here's a great way to think about it. You have this hormone, insulin, that normally acts like a key, unlocking your cells to let sugar in for energy. But with insulin resistance, it's like the locks on your cells get all rusty. The key doesn't work anymore, so the sugar just gets stuck in your bloodstream, building up while your cells are literally starving for that fuel. Okay, so if your cells might be getting, well, a little rusty and ignoring insulin, how would you even know? Right? Let's get into the warning signs. First, by looking at who's most at risk, and then we'll check out the specific symptoms you should be looking for.
Now, when it comes to risk, it's kind of a mix of the genetic hand you're dealt and how you decide to play your cards. Things like your family history or your age, those are things you just can't change. But then you've got factors like your activity level or your weight, and those are things you absolutely can influence. Seeing it all laid out like this really shows you where you have the power to make a real difference.
And here's the really tricky part. These early symptoms are so easy to just dismiss. Feeling tired? Oh, it's just been a busy week at work. Extra thirsty? I probably just need to drink more water. But here's the thing. When you start seeing a few of these signs pop up together, that's your body trying to send you a really clear signal that its whole fuel system is out of whack.
And this right here perfectly shows why catching it early is such a game changer. Over on the left, you've got those subtle little signs we just talked about. But if you don't manage it, things can progress to the much more serious issues you see on the right. We're talking about things like nerve damage, that tingling in your hands and feet, or sores that just will not heal. That progression is exactly what we're trying to stop in its tracks. Okay, after all that, how about some really good news? For all this complexity going on inside your body, finding out where you stand is actually super simple. It all comes down to a basic blood test at your doctor's office. They can check your blood sugar when you're fasting, or they can do this really clever test called an HbA1c, which gives them a picture of your average blood sugar over the last 3 months. It's just a clear, simple way to get a definite answer. All right, so now we get to the most important part of this whole explainer, the part where you take control. Let's think of this next section as your personal management toolkit, packed with all the strategies you need to take charge of your health. And the game plan here is super logical and honestly, really empowering. Step 1, know your numbers. Get that test. From there, your first and most powerful line of defense is always lifestyle. And then, if those changes need a little backup, medical support is right there to help you out. And when we say lifestyle changes, I think people's minds jump to these massive, impossible goals. But look at this number. The science is clear. Losing just 5 to 7% of your body weight can have a huge impact on getting your cells to listen to insulin again. I mean, for a 200-pound person, we're talking about just 10 to 14 pounds. That's a totally achievable goal with an absolutely massive payoff. So how do you do it? How do you get to that 5 to 7%? Well, these are the heavy hitters right here. It's about making smart swaps, trading out the white bread and sugary stuff for whole greens and veggies that give you nice, steady energy. It's about just getting your body moving. Even a brisk walk every day can do wonders. And it's about adding more fiber, which is kind of like a sponge that slows down how fast sugar hits your system. These are powerful, proven changes. And hey, remember that third piece of our toolkit? Medical support. If your diet and exercise need a helping hand, that is 100% okay. There's no shame in that. Medications like metformin are incredibly effective, and they're often the very first thing a doctor will prescribe to help your body get its blood sugar under control. So to really get why this toolkit is such a game changer, we need to look at two things. What happens if you don't take action, and what the actual measurable goals are when you do.
Now look, this isn't about scare tactics, okay? It's about being real, because understanding the stakes is a huge motivator. When your blood sugar stays high for a long time, it can start to damage the tiny blood vessels all over your body. And that's what leads to the really serious stuff. It can affect your eyes, your nerves, and as you can see, that's the biggest risk. But it also affects your kidneys and your heart. Everything we've been talking about is designed to stop this from happening.
And this brings us to something that is absolutely crucial. Successfully managing diabetes isn't some vague idea. It's about hitting clear, specific targets. Think of this table as your personal health dashboard. By working with your doctor to keep these key numbers, your A1C, your blood pressure, your cholesterol, in that target range, you are actively, measurably, and powerfully lowering your risk for all those long-term problems.
And really, this is what it all boils down to. Getting a diagnosis of type 2 diabetes is serious for sure, but it is not a sentence. It's a starting point. The power to change the course of this condition and to live a really long, healthy life is absolutely in your hands. So I want to leave you with this question. Because taking back control of your health doesn't start with some giant, overwhelming life change. It starts with a single, small, manageable step. Maybe it's just swapping one soda for a glass of water today, or taking a 10-minute walk after you eat. So what is your one small change going to be?